Good afternoon, everybody, and welcome. Isn't it so lovely to be in a room with lots of people? It is just much more energizing. You just realize how much we've missed out on over the last couple of years. Just the idea of being able to connect with people, talk to people, have a cup of tea with people and share thoughts and ideas. And so it's an absolute joy to welcome you all here today for the Mind and Body 4th birthday for our Champions programme. I was expecting a little reaction there. Kind of, ooh, yes. 4th birthday, which is amazing. And for the launch of our Quality Improvement Network as well, more of which later. Everybody in this room is interested, as Jill said, in how we try and shift and change our system to do something about the appalling and abysmal stats that we all know that are out there. So we have this, as everybody knows, we have this dreadful situation where for those of us who have a diagnosis of schizophrenia, people will die somewhere between 15 and 20 years earlier than if they don't have schizophrenia, with schizophrenia as a pathology not actually killing anybody. And of course, people develop all sorts of long-term conditions and all sorts of health problems secondary to all the other stuff that comes associated with it. Smoking rates that are at 70% rather than down at 10 to 15% in the rest of the population because people give up on helping people not to smoke. Rates of use of gyms and exercise and healthy eating and all the rest of it that simply is not adhered to and engaged with in the way that lots of us try and do for ourselves and our families. And then of course the other big reason is that when people do engage with healthcare, they have to navigate all this dreadful interface problem. And so you end up with people having mental health problems on the wrong side of the road, if you like, taking our example of Denmark Hill out there, which is a brilliant example of a sort of concrete interface between Kings on one side of the road and the Maudsley on the other. And I work in liaison psychiatry, and I say that when on my more kind of my more down days, I end up saying that what I think I do basically is just help people cross the road a little bit more safely. Because what we're talking about is being able to access care in the right place with the right experts who can actually do something to help people with the conditions that they have. And so that very much is at the core of what we're trying to do in the Mind and Body programme. And we are so fortunate in our local network in King's Health Partners to have both investment from Guy's, Tommy's, King's College Hospital, SLAM, and our partner at KCL to help us set up this group called the Mind and Body Programme, which has been going for sort of several years now. And the Champions Network, as you heard, is now at birthday number 4. But what we're trying to do is work out how we engage in making our services and systems work better. But the idea of the Quality Improvement Network is that what we want to do, the challenge that we're trying to address is, it's okay, we're sort of several steps on a journey to trying to make this work a little bit better in South East London, but how do we sort of burst out a little bit? How do we try and spread best practice across the rest of South East London in our new ICS, our new integrated care system? And how do we also try and take all the amazing knowledge, skills, expertise working in this area out further afield than South East London?
It's sort of music to my ears that this is happening here. We have got the chance in South East London to build on the exemplar that you've already created here and to demonstrate that we are the leading part of the country in terms of joined up holistic care, impacting then through these quality networks, improvement networks, the opportunity to spread this best practice across the country and potentially internationally. And so you are all trailblazers in this. You are vital in this endeavour. So thank you all very much for committing to this programme in that way. But we have the chance to build that exemplar and to demonstrate with evidence that this changes people's lives. And that is the prize that we've got within our grasp. We're on to Award 4, which is the final award. And this is the champion who has advocated for the importance of staff health and well-being, particularly important, I might say, in the aftermath of this pandemic, which has had such an impact on staff throughout the NHS and incidentally the care system as well. So thanks to all of you who have fought on despite all of the challenges. So the awarding panel selected just one winner for this category, and it's been awarded to the South London and Maudsley Staff Support Team. Well done. Brilliant. Congratulations, that's brilliant.
I am Roar Agba. I'm the Deputy Lead in the Staff Support Team here at South London Maudsley NHS Foundation Trust. Our main roles and responsibilities as a staff support team is to coordinate and facilitate various types of reflective spaces to help staff process the emotional impact of the work that they do. And we provide a trust-wide service, so a service for around 5,000 staff. Mind and body, and being a mind and body champion is a very important part of the work that we do. So in addition to providing emotional support for our staff, we signpost people, or we talk about self-monitoring and self-care, and not just the psychological support, but things like exercises, mindfulness, Zumba, healthy eating, smoking cessation. These are just a few examples. And we're also going to do a well-being month next month, which includes some of these activities and much more. We're incredibly proud as a team for what we have achieved. We only 4 or 5 staff, and to provide a service for such a large organization and to adapt so quickly with the needs of staff, I think it's amazing what we have achieved, but also winning an award like this gives us a boost to keep going and build on what we have achieved so far. It's pretty cool. Thank you.
The Mind and Body Champions Network is amazing. We've got over 1,000 champions now, and they're from all disciplines and all parts of King's Health Partners, and they're bringing together the care of mind and body and responding to the whole person. What I most want out of today's event is that people watching this video sign up. So on our website at KHP, all the details will be there, and we want everybody from across the system, whether you're a nurse, whether you're an OT, whether you're a social worker, come on, sign up, because we need everybody to be a mind and body champion. But really, to launch the Quality Improvement Network has been absolutely fantastic, and it takes our flagship KHP programme and turns it into that next journey that we want to have to make sure that as many trusts and as many teams, whether that's in the community or in hospital, are able to work together to really deliver holistic mind and body care. So it's been a complete triumph. It was brilliant to see Norman Lamb delivering the awards, and great to have Lord Kakar finish our event today with such a rousing chorus about mind and body.